calipered kinematic knee replacements. So this technique is a very unique total knee replacement technique. So the calipered kinematic technique was found by Dr. Stephen Howell, who is a knee surgeon in the United States, and my boss in Mumbai was trained under him for the same technique, and I learned it through him.
Welcome back to Shauryaverse, where the young mind meet the real worlds. Last time, we explored the world of knees. This time, we will step into in the mind of a surgeon. Is it like Grey's Anatomy, dark caffeine chaos, or calm clinical brilliance? Our guest, Dr. Raunak knows. He's performed over 3,000 surgeries, global training, robotic precision, and so on. So, if you've ever dreamed of holding a scrub or just wanted to peek behind the green curtain, stay tuned because you're going to meet the man behind the mask.
Every legend begins with one step. He studied not just medicine, but every fracture of the human spirit, from sports to the quiet classrooms of Helix, to the high-stakes theaters of trauma. With over 3,000 surgeries, every incision became an act of restoration. And every life rebuilt became a legacy reborn. Trained across the UK and Australia. These experiences and learning from the best minds in India and around the world have shaped his practice. He chased excellence across continents and brought it home. He is none other than Dr. Raunak, a consultant orthopaedic trauma, robotic joint replacement, sports medicine and arthroscopy surgeon.
Namaste, Dr. Raunak.
Namaste, Shaurya. Thank you so much for having me on your podcast today. It's actually a great honor for me to be on your podcast because I've been watching your podcast since a while. And let me just tell everyone that she has been doing excellent at her age, and whatever she is doing, it's just fabulous. Moreover, because she is my niece, so I'm very proud of her. So yes, thank you so much for having me here, Shaurya. Let's go ahead with the day.
Dr. Raunak, you've done over 3,000 surgeries. When did you know this, which was your this is it moment? When did you realize you wanted to become a surgeon?
So, well, Shaurya, thank you so much for this question. Well, for the this is it moment, I will have to take you back 10 years in time when I happened to be posted in orthopedics and I saw an actual orthopedic surgery being done, wherein, there were all the hammering being done, there were implants being taken out, there were implants being put in another case. That somehow just excited me. And well, that day I was stunned for the first few minutes, but I stayed longer and longer, and I came out after 6 long hours, and then I decided that this is it. I just want to do it. And that was my this is it moment.
You've trained in India, Germany and Australia. But did the medical training feel the same across the countries? And side note, did you have more free time in Pune or in Australia?
Well, Shaurya, that's a wonderful question. Let me just tell you that the training that I received in India, I did my master's training in orthopedics in Pune, wherein, we were working insane amount of hours during the Indian training. However, when you step out and you go as a trained personnel in your specialty overseas, and you actually get to know the work culture there, I will definitely say I had heaps of time for myself when I was training in Australia, and compared to what it was in Pune or in Mumbai as well, where I trained after my master's degree for my fellowship training. So definitely overseas there is a concept called work-life balance, which unfortunately does not exist in our country. But well, every training has its own pros and cons, and not just training, but every country also has its own pros and cons. So I feel all of my trainings that I have done have given me something very valuable which I have learned and gained and has, credited to my abilities to become a good orthopedic surgeon.
Okay, let's get nerdy. You're the only one in the Vidarbha doing Caliper kinematic knee replacement. It sounds like a Marvel weapon. So, why is it such a game changer?
So, about Caliper kinematic knee replacements. So, this technique is a very unique total knee replacement technique. So the Caliper kinematic technique was found by Dr. Stephen Howell, who is a knee surgeon in the United States, and my boss in Mumbai was trained under him for the same technique, and I learned it through him. Well, the unique thing about this technique is that we are doing a measured resection of the cartilage of the knee joint that is worn out, and we are replacing it with a single radius implant, which is exactly replicating the kinematics of your knee joint. However, 99% of the surgeons, what they are doing is a mechanical knee replacement, in which the alignment is mechanical and they are making your knees just straight. However, we are replicating your original knee alignment, what it was before the knees were worn out. So it's quite difficult to perform, but you do it quite often, and then you can definitely do it.
You really work with robots in the OT, and now I have to ask, is it like sci-fi or just cooler robotic tech with more precision?
So, Shaurya, I'm sure this question comes to minds of so many people who are suffering from knee pain as well, and even younger people like you. So, the thing is, robots have been around since about more than 70 years, but now in the recent times, their usage has come up in the surgeries, like the robotic surgeries. However, the robots that you see folding papers and so many of the robotic arms going in, that is not the robot that we guys work with. So that is another robot for the surgeries done by urologists, neurologists, or general surgeons and gynec surgeons. The robots that we use are basically robotic systems having a robotic arm, which we use to make the cuts in the bone and maybe ream the acetabulum when we are doing a total hip, or in the knees, make the finer cuts with the minute details to the planning that we have done for the patient. We also get to play around with the alignment of the patient that we want to put our implant in. So that's more like about getting the right precision, getting the right alignment for the patient, and having the accuracy to the millimeter when we are using the robotic systems.
So basically you're performing millimeter perfect precision surgeries with robotic assistance. I can't even cut a line on a paper straight.
So that's where the world is heading at, Shaurya. We have to do the surgery right to the perfect. We have to do a perfect surgery right to the millimeter. And I've been trained on 2 robotic systems and 3 navigation systems, 3 of which are not yet launched in India. I'm hoping they do launch soon.
So that you can work on them.
Of course.
What's a surgeon's day really like? Is it like Grey's Anatomy, or just lots of walking and caffeine and lots of stress?
Well, Shaurya, that's a very good question there. Definitely there's a lot of caffeine involved in it, but I won't say it's exactly like Grey's, but somewhere I will tell you what exactly my day looks like. So I usually wake up at 5:30 a.m. in the morning. I hit the gym at about 6 o'clock. I work out for about an hour and a half. I come back, make my breakfast, have my protein, and then I get ready. I rush to the clinic, or if at all I have a theater or a case in the morning. So that usually lasts for about an hour. If it's a longer case, if it's a bigger case, might last for about 3, 4, or sometimes even 6 hours. So if it's not a longer case, then I will probably rush to my clinic, where I spend about 6 hours. I give enough time for my patients. I make sure that they don't have any more doubts when they are walking out of the consultation. And then I take a break of about an hour or so for my lunch, maybe check what my rest of the day looks like, if I have some other commitments, if I have to attend some clinical meeting, if I have to be present somewhere online, if I have to be somewhere in person. Accordingly, I plan my evening, and obviously in the evening I start my clinic at about 6:30, and that sometimes goes on till about 10 o'clock. And if sometimes any emergency patient comes, I have to give my time there as well. Or sometimes there are patients that we need to take on immediately. There are certain fractures which need to be fixed immediately, so we go and take on those cases. And sometimes I do sleep at about 1 or 2 o'clock, but again next day I do wake up at 5:30 again. That's more like my day.
Well, that's a packed schedule. But do surgeons even panic in the OT? You can be honest.
Well, surgeons are still human beings, and as being a part of human, it is in our nature to panic. But what matters more is how you react to a situation. Like there was a case that I did recently. It was a total hip case, and patient was bleeding in the theater. There was lots and lots of bleeding, and patient has lost a lot of blood. Well, everyone around me panicked, and there was a stage where I also started to panic, but the only thing, my bosses, I'm grateful to have great teachers. They taught me one thing, that you just need to be calm. You need to access the bleeder and you need to cauterize it or tag it. That's exactly what I did, and that one step calmed down the mood of the entire theater, and we proceeded with the surgery. There was no stopping from there on. So yeah, we do panic, but it's more like the reaction to whatever is happening around or in front of us. So many experienced surgeons panic as well, but we don't see them panicking, because that's their expertise in their own field that tells them what needs to be done in a situation, and that only comes with experience and with time. So there it is.
So being calm is the key. What is the most unexpected thing that happened during a surgery?
So during one of my surgeries where I was operating, it was a trauma surgery, and then I went in with the plan that I wanted to execute, and somewhere I just happened to see some infection. And yeah, so when you don't see any signs of infection in the patient clinically, and intra-op you see some infection, you have to change your plan right at that moment. So everything changes. Everything that you have planned, you cannot execute it, and then you need to have a backup plan ready right at that moment, how you want to bail out in that situation. Thankfully, I had the backup ready. Just I have my experience of these many years, wherein I learned to always have a backup plan ready during any surgery. Always have the armamentarium ready with you on table whenever, because you cannot expect what might go wrong. You might just have to change the plan of surgery. And so yeah, that was one of the experiences. Another experience maybe I'd like to share was during my training, wherein I was operating on a patient, and one of my assistants happened to touch his specs because it was his first day. You can't touch anywhere apart from the sterile area and stand there. So he happened to touch his specs, and he stood there for another 5 minutes. Thankfully, he was standing away, and I noticed him touching his specs with the gloves on, and I had to ask him to leave the theater, to leave my operating room, to maintain the sterility. You cannot risk a patient's life with unsterile gloves around the theater wherever you're operating. This does happen when you are too callous in your attitude when you're operating, but for me, it's about a patient's life. I always imagine my patient to be someone my own, wherein I am connected at that level, and I make sure I follow those rules of the theater, wherein there is complete sterility in and around me when I'm operating the patient. So yeah, that was the question to your answer.
So your assistant touched his specs. So what is the importance of sterility in a surgery?
Excellent question, Shaurya. So see, you're wearing your specs. I'm just giving you an example. If you are my assistant, you're wearing a specs, and you're wearing the specs everywhere. Okay, you traveled here to the theater, for example, with the specs on, and you're standing in my theater. So when you're coming for the case, you have to wash up, and definitely we don't wash our face, we don't wash our specs, and they still stay unsterile. For the most part, we do recommend changing the eyewear that you're wearing in the theaters. Okay, but there are instances where the specs have fallen. That's why some people try and put a bandage on their face to not let those fall. Okay, there are of course astronaut suits wherein you can wear those specs, and even if they fall, it's okay. You can have a mask down your nose as well, but you can't risk your mask going down. You can't keep your nose open in the theaters. So the bacteria that were on the specs during the time you were traveling towards the theater were still there. Okay, and if you have not cleaned your specs with a sterile solution, okay, with an antibacterial solution, okay, those bacteria are going to be there. And God forbid, if you are scrubbed up properly and you are touching a sterile glove to your specs, having those bacteria climb onto those gloves, and then you're handing me an instrument that I'm using for the surgery. Imagine those same bacteria from the specs on the glove to the instrument getting in patient's body will definitely hamper the outcome of the patient and his surgery. I can't risk that in my theater. So that's why I had to ask him to leave.
So how do you mentally prepare yourself when someone's life is in your hands?
So, well, that's part and parcel of being a surgeon, because you never know what situation you might come across. You have to be mentally strong. You have to prepare yourself for the surgery that you are doing. You have to know that you are capable of doing this particular surgery on the patient. Of course, patient's life is a big thing, and being in a noble profession, people trust us with their lives, literally. So whenever we are entering a theater, obviously you have to assume all the possible outcomes of the surgery. You have to be thorough with all the steps of the surgery. You have to revise it, and then whenever you are encountering any alien situation that you have not anticipated, you have to make sure that you are calm and you're responding to that situation properly and not panicking, because it's the patient's life in your hands, and it's the patient's trust in you that they have asked you to rectify their issues or to treat you for their pain. And as a doctor, I feel that is the greatest honor we get to treat a patient and get the patient out of the theater safely and get him back to mobility.
What's one tip or what's one thing a medicine student should immediately stop doing right now?
Okay, so probably the Gen Zs now, I guess. One thing I will request them is probably stop wasting time on the phone by watching reels. They can invest their time in reading good books and updating them with good knowledge. I'm sure all are aware of the exams that are there.
If a 16-year-old is watching this video dreaming to go into med schools, or someone who actually is in college right now wondering if they've got what it takes, what's one real unfiltered raw advice you'd like to give them?
So a pro tip in this will be to embrace themselves, because getting into medicine and becoming a specialist and now a super specialist with having subspecialty interest, it's going to be a long road. You make sure that you are patient, stay calm, obviously, because things happen. Have some patience. Things don't happen overnight. It takes time. I spent about 8 years in orthopedics to, gain all this knowledge, and it's just 8 years in orthopedics and 15 years in total in medicine till now. So, there are specialists who have spent years and years and decades in this specialty. So obviously, and find a good mentor for yourself who is always going to back you and tell you that you can do it. There will be ups and downs. It's not a smooth journey. It's a rocky road. So don't get disheartened if you don't score well. It's okay. You can always come back stronger. You can do better. So you need a proper guidance. And then, if anytime you guys feel that you need some advice, you can always DM us.
My mind is blown. I came here with creaky knees and left with a huge respect for what it takes to heal them. Whether you're a medical student who's in learning phase or you just want to book for your next knee checkup, you just heard from a man who just turned surgery into an art. That was Dr. Raunak. So, if you want to know more, please like, share and subscribe to our channel. Until then, sit straight and keep your knees moving. Thank you.